everything I've done over the years. It's really how I keep my sanity to help other people and learn how to navigate the system. It makes me happy, especially when it's 100 degrees outside and I'm just in. So my little disclaimer, I'm not a psychologist. I'm not a social worker. I am just an LMS patient for 19 years. And every day I would just sit down with myself and say, how do I do this? I had 2 years of NED in the beginning. I had 4 years of NED after that. And in 2008, when I really needed help for myself and other people, I sat down and I developed a little program of helping people based on what I've been through and what I've seen hundreds of other people go through. And every day I still learn something new based on my own body falling apart. So I am just like you. I think it's important. I'm living right now with about 25, 30 tumors all over my body. I still walk my dog, and I still primarily take care of myself, and I'm my own advocate. So, so one day in 2008, when I was just pretty much a distraught human being, when I got re-diagnosed, I sat down at my table and thought, I need to develop a program for myself to feel better about what I'm doing. And so the first thing I thought of was obviously, what is in your head? So much of what I do is creative thinking and my attitude towards my own health and well-being. So I thought, you know, and I'm not speaking to depression. That's a whole different thing for people. So if you're truly having some type of psychological illness, that's not what I'm doing here today. This is a program I developed for just first taking me out of my own head and thinking, how do I feel better today? It was pretty simple. How do I feel better today? What do I do? Who do I call? So the first thing is your own psychology. The second thing is your socio-psychology. Who are the people around you? How can you motivate them to help you? How can you get strangers to help you? What groups do you need to join? What would give you the most support that you possibly can get for yourself? So that was the second thing. And I learned particularly that from a person long gone named Kathy Fromberg Goldring, who developed an entire program of support for herself in the old days when we had just email. She developed a network that was unbelievable for herself online through her temple, her kids' school, her work, her husband's work. And it was really, I got to sit and watch that. And that was the primary thing that said, okay, I don't want to do that. I don't really need that level, but how do I do something for me? So that's the second thing. The third thing that was really important to develop for me, because I know there's a lot of other people like this out there. You know, I had very big financial ups and downs during these 19 years. So it's the whole reason how I learned how to negotiate medical bills and deal with insurance companies. In 2003, I was so upset, I actually went to work for an insurance company. They hired me in the middle of cancer. So I thought to myself, you know, how do I develop a financial means of support for myself and teach others? How do we make phone calls and, you know, everything. So I had a whole financial thing to develop. So that was the third thing. The last thing, I said, okay, my medical paperwork, how to speak to my doctors, how to deal with the financial people at the hospitals. How do I do that? So those were my four major categories of dealing with my life, you know, personally. And so in my head, crazy me gave me control, made me feel better, made me feel like I was doing something for myself, even if I really wasn't that day. But then in about 2009, an attorney called me one day and said, you know, Amy, I heard you taught yourself how to do really weird things with insurance companies. And I have an 80-year-old mom going through Medicare and something's not working right. How can you help us? So it was through him and his company that I really learned how to professionally advocate, and how he's sort of like, well, why aren't you getting paid to do this? So it's actually his fault that I started getting paid. And through that, I've done a lot of crazy cases. So today we're going to get started as a request. We're going to first talk about a little bit about how to organize your paperwork and how to go on doctor's appointments, a little bit about insurance. But I want to explain to you how important it is in your head. The biggest thing we have is that we ignore our bills. And I understand this. They come in the mail, they sit there. We can't even look at them till possibly they go to collection. So what I want to teach you how to do a little bit today is just to deal with your paperwork, number one. My first case was actually an elderly couple. The husband had Alzheimer's, and the wife was typical of women, you know, a million years ago. Her husband did all the finances, he did all the paperwork, and he had Alzheimer's and didn't even know what was going on. And she had to deal with this box. So I'm over her place, their house, and I'm with an accountant, and he brings me this box to go through. To make a very long story short, the beneficiaries of their life insurance policies had passed away. The wife wasn't even the beneficiary. I found them $45,000 in an annuity they didn't even know they had, just reading their paperwork and going through things. Their trust wasn't properly done. So if the husband died, the wife wouldn't even really own the house properly. It was just so crazy that they hadn't looked in this box for so many years. So I want you to look in your box. I don't care if you're in your 30s, in your 40s, your 50s, your 60s, 70s, 80s. I want you to look in your box. And if you can't look in your box, my goal for you today is to just find someone that will help you look in your box. Somebody that you trust, whether it's a financial person, an accountant, your best friend. If your husband or wife can't do it, I don't care who it is. Look in your box and sit down and sort of do a money assessment and a financial long-term plan as an assessment. And I know a lot of us here are in different places. Some of us have no money. Some of us have some money. Some of us have a lot of money. There's COVID going on. There's all kinds of crazy things going on right now in this world. That's why it's extraordinarily important at this time to look in your box and see what's in there. So with all that being said, now we can move on to, I'm going to do how to go on a doctor's appointment last. I know, Sharon, that seemed to be a big on the request line. But since I'm talking about money and insurance, I'm going to do that a little bit first, and then we'll get in the doctor's appointment last, if that's okay with everyone. So it means you have to stay on here. So, anyway, so insurance. Number one, when you get some crazy bill that you don't know what it is, this is not brain surgery, by the way. I'm not a scientist. I'm not even very much a scientist of my own health. I'm not very analytical. But first, if you get a surprise medical bill, is it a mistake? Frankly, you got to call the insurance company and say, you know, is this an error? Because I can't tell you how many times that it's just a mistake when you get a crazy bill and people are just, they get so upset and scared. So call number one and find out if it's a mistake. I had a client a few weeks ago who got a $350,000 medical bill, because I know when you hear why, you're just not going to believe it, for their elderly dad, because he was stuck in a hospital, and they couldn't, he didn't have COVID. They couldn't transfer him because he couldn't go to a nursing room or home. So they kept him in the hospital. Part of that bill was the fact that when he got Medicare a million years ago, the family forgot to buy him a supplemental plan. So he didn't have a Medicare Advantage or HMO or PPO. He just had straight Medicare. So just from that, that's a huge amount of money. So if you have a large medical bill, first find out if it's an error, or first find out if you're insured properly. But also, you are recording everything, right? You're calling the insurance company. You're getting the reason for the bill. You're writing down the name of the person you spoke with. I don't know if you're all familiar with medical coding, but everything in your medical bill has a certain code. So for example, preventative gets coded a little differently than diagnostic. So I'm calling the insurance company and I'm saying, hello, insurance company person. This is Amy Reagan-Strife. I have stage 4 metastatic leiomyosarcoma. I need your help. No anger, no nothing, no emotion. This is a business call and you want that person to know that. And I always say, I need your help. I'm not angry. You know, I said, I need your help. I need to learn something. Help me. How did this bill come to be? You know, and depending on that reaction, and I want to tell you something, sometimes you call twice or 3 times because the person on that side of the phone, they might be wrong. I've learned that as well. So like, you know, you sort of like set aside a day when you have your coffee and a snack and you know you're going to be on the phone, or you go on speakerphone, you know, you could be on the phone for 2 hours, you know, till you get a good person or till you can ask for a supervisor. So you really want to know how that bill came to be. And I've said to people on the phone, is there any way to change the medical coding to make this a lesser bill? You know, what are you going to teach me today about this bill? And I say it just like that. So I have gotten various responses to that. So let's say you find out it's a real bill. You know, it's a real bill. How do you want to deal with that? Do you want to try and negotiate it? Do you want to try and make a payment plan? Don't let it go to collection. Make up your mind, you know, shortly what you're going to do with that bill. Call the institution immediately. Call the medical institution immediately and get to a financial person, and you can clarify with them again that it's a real bill. So let's say you determine that it is a real bill. How do you negotiate that bill? How big is it? Is it a $500 bill? Is it a $10,000 bill, a $2,500 bill? How much is the bill? How much, number one, how much can you afford to pay on that bill? I have to tell you, the person who has the $250,000, $300,000 bill, they called their financial institution and they made a $50,000 offer and it was accepted and the bill is gone. So if you have a $500 bill, let's say, or a $10,000 bill, you might want to call your medical institution and say, I have $500 today for that $10,000 bill. I mean, I'm telling you, I don't want to use the term low ball. You know, you call them up and you say, I have this much money today. Can that get rid of that bill? And sometimes it does, but you want to call and be honest and be businesslike if you're really trying to just get rid of a bill. What if you really can't pay a bill? Can you pay? Or what if they really won't accept a really low payment? I've seen people pay $5 a month, $10 a month, till finally then they call a month later and the institution says, okay, forget about it. So I really want you to have what's called, I don't know if you're familiar with this Yiddish term, but in a nice way, you need to have chutzpah. You need to be businesslike on the phone and just, you know, not be afraid. I want to add, cancer is full of, we've talked about this, cancer is full of guilt. Cancer is full of being ashamed of things. Cancer is full of, you know, being embarrassed if you don't have enough money to do something. And I get all that. But this is the time to be businesslike and be really proud of yourself and try and get on the phone or in front of someone and negotiate this bill as if it were your business and not your illness. So also in the bill negotiations, sometimes it is okay to have something go to collection. You know, there's 2 ways that a collection company is owned. A collection company is owned by a medical institution, and a collection company can be privately owned. So
if you know that the collection company is owned by the medical institution, then you can still negotiate. If the bill goes to a private collection company, it's that much harder. So, sometimes insurance, so that's on the bill negotiation, is number one, to figure out, is it best to make an offer? I also want to tell you that some medical institutions have charity. They don't talk about it, they don't discuss it, but it's a good thing to say, get on there and go, do you have charity? Do you have financial assistance? So I need to know everything that is available to me. So that's a short version of bill negotiation. So have chutzpah, ask questions, be analytical, record all your data, take notes, and then go on from there. So now, I was also asked to talk about insurance and how to get things appealed through an insurance company when they say no on something. They say no on a surgery, an interventional radiology procedure, all that kind of stuff. They say no a lot from what I'm hearing lately on like ablations and things like that. So how do you get them to say yes? Sometimes it's actually easier on appeal to get something approved than it is right off the bat. So obviously you call an insurance company just like everything else, like a business person, and say, this was turned down and you're going to appeal it. Most of the things I get okayed that are not okayed in the beginning are actually on appeal. I don't know why it's easier that way. I don't know if it goes to a supervisor more easily, but sometimes going on an appeal is actually easier. So when something goes on an appeal, what do? You obviously are going to get doctor support, right? Your doctor knows everything you're doing. Not only do I fill out the standard appeal paperwork, but I let my doctor know what I'm doing, and I want my doctor to go to bat for me as well. So I hope you all are communicating well with your doctors, because they need to help you with a letter, have their office manager make phone calls, whatever that is. So you're getting some help from your doctor on that. So you call. So you also get evidence from, what other patients are doing. I mean, that's the point of really being online, is to see what everybody else is doing. So if everybody else is getting an ablation and you're not, that's something to point out, either by using statistics from LMSDR or the Sarcoma Alliance, or whatever it is, or wherever it is you're getting your statistical information. That's really important as well, and that's for the insurance company. Also, when you call the insurance company, you want to talk to an advisor when you're working on an appeal. You just don't want that regular person on the phone. And this is where I get a little crazy on appeals. That's worked well for myself and also for other people. I actually get a brick and mortar address. I get a brick and mortar address of the insurance company. I actually get a name. Sometimes big insurance companies have, they have corporate patient advocates, and I write them. I write them real letters, and I write CEO letters. And so I really do very strange things. Or I fax if they accept a fax. And I track the letters, and I know when they got there, and I know who is receiving them. And then I follow up on that. So if you're really having a heavy duty appeal that's not getting approved, I do that, and I write letters. And I'm very statistical and somewhat emotional in my letters. They can be very weird. I'll give you an example of a case I had recently that has nothing to do with cancer. I had someone I know woke up in the morning with their vocal cords frozen. And I think I wrote about this on the Facebook group, but they woke up with their vocal cords frozen. And this person is actually a doctor. And she couldn't breathe very well, and she couldn't speak very well. And there was a surgery that was available to this person that could make her 100% well. And her insurance company would not authorize that. So that was crazy. So I found a corporate patient advocate within the insurance company, and I sent her a letter and called her. And I also sent the CEO of the insurance company a letter. It was a very small insurance company. And through that letter, her insurance got approved with, a pretty huge apology. So there's avenues that you can take that I want you to think out of the box with, chutzpah. I want you to think out of the box. If you're not getting something that you want through the regular channels, and you're trying to appeal something, let them know that you're going to take all these different avenues to get this approved if it's not working. A couple of times I had to file complaints with the state of California against the insurance companies, and that got the people approved. So I guess my point is, I want you to fight for yourself and not accept the norm, no matter, what that is. Even if they appeal, even if they turn it down a second time. So I suppose someday we should have like a letter writing class, because I've done some pretty crazy letters in my time to get people all kinds of drugs and financial help and things like that. But I want you to keep asking questions. So we'll move on. And if you have questions, save them for the end, because then I'll answer. Because I know most people wanted to know how to go on a doctor's appointment. Who takes the complaint against the insurance companies? Sharon, to everyone. The State Insurance Commission of your state takes complaints against insurance companies. That's who does that. And that is a formal, that is like a pretty formal form to fill out. But they actually will discuss on your behalf and look into it. It takes some time. But where I've had the most success really is getting a supervisor on the phone and my brick and mortar letters, in the financial stuff, in appeals, in all of that. What you say and what you do to make it personal will help you a lot. So save questions for the end. So now we're going to go on to how to go on a doctor's appointment, which we're going to spend the most time on. And ask me a lot of questions on this. Okay, so number one, going on a doctor's appointment. Remember in the old days when your doctor was like a god? Maybe your mother or father told you, not to question what the doctor says because he or she knows everything and we know nothing. I'll never forget the first time, actually, and I let you guys know from reading my stuff, I absolutely love my doctors. But I'll never forget the first time I saw my sarcoma specialist in 2001. And I went into the office and he said to me, "Do you research on the internet?" I mean, he just flat out asked me. And I think that probably was when the internet was just invented. I'm kidding, but I think it was. And I just said, "Yes, I do research on the internet. So he just went, "Oh." So, I'm sure many of our doctors just can't stand the day that the internet was invented, because if you've had one question, now all of a sudden you have 50 questions and they have to sit there and listen to it all, and it makes them crazy. So as usual with everything else, when you go to your doctor, don't be quiet, don't be ashamed, don't feel guilt-ridden, don't feel like you're wasting their time. Don't feel like you have only 20 minutes. I mean, to this day, my sarcoma doctor, after 20 minutes, and I've been seeing him 19 years, wants to run out of the room. I can tell he's in, he wants to spend 20 or 25 minutes with you, and I make him sit there and I make him crazy, and that's like our little routine, and I just love him. So again, if you can't do this, if you are not well enough to do this on your own, get someone to do this with you, for you, because I know that everyone cannot do all this advocating for themselves by themselves. It's really hard. So on your doctor appointment, I think it's great to learn some communication skills. You don't have to be a scientist and know everything about leiomyosarcoma to really do a good job advocating for yourself. I'm not very scientific. I don't understand everything about immunotherapy. I don't understand everything when new stuff comes out, but there are certain ways of communications and questions you can ask that get the answers from your doctor that you're looking for. So for example, plan before could you stop kissing the dog? I'm trying to teach a class. My daughter's kissing my dog. So anyway, so these are questions. So do your research before. And what are you going in there for today? Is it a first appointment? I know with everyone on here, we're all over the board. Is it a first appointment? Have you been seeing this doctor for years? Is there a specific body part you're interested in? So you don't have to be scientific on these appointments, but what I really want you to do is be analytical. So an example is, if you just had a scan and you found out that you have something new in your liver, you just have to go in there and don't wait for the doctor to tell you. Say, what are all, they may not apply to you, but you want to know, in case they don't tell you something, what are all the treatments that people have when they have tumors in their liver? What are all of them? Because you may go into your doctor's appointment, and what is he or she going to say? He or she is going to say, well, I think you should do chemotherapy. And you have no idea that people who have liver issues, there's embolizations, there's ablations, there's chemo, there's surgery. So I want you to be analytical about why you're going into that appointment. Is it a general appointment to go over a scan? Write your questions down before. Am I going in there because I have lung mets? Because, what is the reason? The other day I saw my doctors because I have a new tumor right here on my head. And that's what I went for that day. And I had all my head tumor questions, written down. And I think I made him crazy because he's going away on vacation. So I wanted to know everything about head tumors. So, so be analytical. You don't have to be scientific. You can be scientific later when you go home and do your homework and you want to Google stuff and read. But on your appointment, be analytical because, in the Facebook group, especially with body parts, livers, lungs, I don't know, all kinds of parts, people will come in and go, what's an ablation? What's an embolization? My oncologist, my sarcoma doc didn't even mention that. So try and, and make them answer you. Say, if I don't want to do chemo, what else is there? What are all the treatments? So don't wait for like a second or a third opinion to learn that, oh my God, I had no idea that existed. So be analytical on your appointment. Know that there's pretty much, 4 or 5 choices for leiomyosarcoma in general. You're either doing a surgery, a chemo, immunotherapy, interventional radiology, radiation. Is there a clinical trial? So if you keep those categories in mind and you have metastatic disease, on every appointment, you can go in and make your doctor crazy and say, what about this? What about that? And why? Keep asking why. It's like the most simple thing you can ask. It's like when your mom or dad looked at you when you were a kid and you kept saying why, or how, or when. So you really want to know why. So this is about, me personally, as I've said, I've never been scientific, but I can be super analytical and just know what questions to ask. My favorite question I'll never forget this. I asked this I have the same surgeon for 18 years. And I said to my surgeon one day, what is your criteria for doing a surgery? When do you do a surgery? When do you not do a surgery? These are really important questions, in analyzing if you want to have surgery or chemotherapy or or an ablation. So what is the exact criteria for doing a surgery? So he said to me, I'll never forget this. He goes, well, I look at margins. I want to see if I can get as much as I can get. I want to see if I can get everything. I look at that person's quality of life. I look at who they are. and he said, and you know, the thing with the physician really, you know, and I think of in my back of my mind of doing no harm. So is that person better, will the person be better off with this surgery than without it? So ask your doctor, you know, what their criteria is, because really they'll probably tell you. Another thing I wanted to talk about that's like emotional when you go on a doctor's appointment, and why I want you to be more businesslike than anything else, is that I can't tell you how many times I've gone to the doctor, different doctors. I had an interventional radiologist do a kidney ablation on me, and he's wonderful and I love him, but he said to me one day, this was just prior going into the procedure. He looked at me and he said, you know, Amy, what I do is not going to cure you today. Like, I think he said it 5 times. So he said, I'm not curing you. I'm giving you palliative care. Do you understand that? So I said, yes, yes, yes. So, you know, and then I'll never forget this either. I was referred to a lung oncologist. So I was going to do VATS, video assisted thoracic surgery. I was getting what we thought were 6 mets removed from my lung, ended up to be 4. But anyway, he looked at me and he goes, I don't want to do this surgery because I don't think it's going to affect the day you die. But your surgeon, your regular surgeon, says I have to do this. This is what he said to me. And he happens to be like a genius. He's actually the father of VATS. He invented the whole thing. So, so I knew that I wanted him to do it. So I don't think he was doing it to be a jerk. I think he was doing it to look at me and see like where I was emotionally and how I would react. So I just looked at him and I said, I highly doubt I'm going to die the day you think I am. I said, so it's really important we get this stuff out of my body. And he just looked at me and he said, okay. So part of your deal on going part of your job on going on a doctor's appointment really is to also know that it's not going to be that warm, fuzzy thing, empathy, sympathy thing, you know, educational experience that you might really want. It's not. I mean, you know, so the whole point of getting that doctor's appointment, especially in metastatic disease, is to achieve your goal of why you're actually going on the appointment. You know, that day are you going for the education of it, to figure out what your next step is? Are you going to get your liver? Are you going to get something out of your lung? Are you going to get something off your head? Are you going like, what is the goal of the appointment that day? And how do I get it? And that's pretty much it. And I save all my emotion for when I get home and I call one of my best friends up and I say, that guy was an asshole today. I mean, honestly, what a jerk she was today. So, you know, that is always, so I am really like analytical pre-goal. What's my goal for that day? What am I looking to learn? If I left without learning it, what happened? Why didn't I learn it? What did I do wrong? What can I do right the next time? So it's just a consistent sort of, I hate the word journey, but journey in palliative care, not knowing what's going to be next, because I always think that I'm doing this procedure next, and then I end up doing something totally different based on what everybody is telling me. So as best as you can, figure out a goal that you want to achieve on your appointment. I think I should talk a little bit about getting a second opinion on a doctor's appointment, especially if, you know, maybe you're trying to get that approved with your insurance company. How do you do that? You pretty much have to prove that the first institution or doctors that you're seeing are not experts in their field. So do I have, I should address, Do I have any suggestions about how to save the emotions for later? I think you have to learn, and I since I've been talking about emotions and everything, I'll take that now and I'll go back to second opinion. So I've learned to ignore myself. I think we talked a little about that in the Facebook group one day. So I'm not saying to ignore your emotions and ignore yourself, just on your appointment. You know, and if you can, that's the idea of bringing someone with you and having them advocate for you. So I sort of have learned how to ignore myself till later. And I think about the appointment when I leave. And then I ask questions and do all kinds of things later. I mean, I don't know. I think for everyone it's different. So you have to find yourself a place that you can be to put your emotions for a little bit. I hope that helps. I don't know, because I'm just weird, honestly, on the emotional level. So, you know, I just ignore. I know that I'm on a business appointment, and then I take care of everything else when I leave. And I might even go cry to a nurse or scream in my car. You know, it's not that I have no emotions. I just save the release for later, and I get a little crazy later. And I don't want you guys to think after 19 years that I don't think about cancer every single day or every hour, every minute. I am consistently, just like you, thinking about, like, medically, what's next? What am I doing? What am I feeling? How do I do that? So I've just learned in certain situations to be a really good person on how to ignore myself. So getting back to a second opinion on, you have to prove that the former institution, again, doesn't have an expert. Like, I've broken a couple of people over the years out of Kaiser because they'll say that their sarcoma people are experts, but they're really not. So what is a sarcoma expert? Somebody who sees at least about 100 cases a year. You know, if that person can honestly say that they see about 100 cases a year, and you'll find this on the Sarcoma Alliance, I think this criteria, I think you'll find it on LMSDR, the Sarcoma Alliance. In other words, what is a sarcoma doctor? They see 100 people a year. If there's a surgeon, have they, ever done a sarcoma surgery before? Have they done an LMS surgery before? Do they even know what, how many people have walked into an HMO situation and their doctor will look at you and say, I have never heard of that cancer before. You're my first patient ever that's had that cancer. That means you have to get out. You can see them in the beginning, but then you have to get out. So you have to appeal to the insurance company that there was no expert. You have to get letters from professional organizations, maybe even the next doctor that you have an appointment with, that is the sarcoma specialist. Maybe there's no professional, maybe there's no real interventional radiologist there that understands sarcoma, or regular radiologists. So you basically, are proving through professional organizations, through other patients, through other doctors, that they don't have a specialist that can deal with you. And sometimes you have to get a little nasty. I'm getting an attorney, I'm filing a complaint with the State Insurance Commission. You have to understand the criteria, be very specific, and nicely threaten. Say, my next letter is going to be from my attorney, one letter, or a patient advocate or something like that. So, so you have to appeal just like you would anything else. Okie dokie, as we move on, I'm going to see what questions are now, because I don't think I'm going to chat. Did I get the chat? Yes, this is recorded. Make a donation. Who takes the complaint against the insurance companies? Okay, so we answered all those questions. Okay, we're going to move on. Other questions to ask doctors on an appointment. What is it that I don't know about? What are you not telling me? I don't know how you guys feel about asking about, I don't ask about any statistics about life or death. I don't say, how long does your average patient live? I don't say, all those kinds of questions. But I do look at my doctors often and say, what are you not telling me about what I have? What are you thinking? So that's always a great question to ask as well. There's a very old-fashioned question that people ask, if I were your mom, if I were your daughter, if I were your son, whatever, would you be doing the same thing? What you'd be recommending? So you guys don't have any questions about going to the doctor? Is there anything that's bothering you personally at the doctor? Before I go on to other stuff, I'm going to talk about a little more about financial aid. Nada. Okay, something that I didn't talk about earlier is I want to get into a little bit about financial aid, because there was someone that I read recently that really wanted to know, with everything going on with COVID and job loss and everything, how do you get any kind of financial aid from community services? And that also is really based on, calling them as well and saying, this is my situation and what are they willing to do? So don't hesitate to call your utility company if you need help with something. They're out there actually giving all kinds of aid to people. Whoever your landlord is, just call. Anytime you get a bill, you call up and you just say, what can you do for me? You guys have any other questions? I thought there'd be more questions. I left a lot of time for questions. All right.
Hello.
Yeah.
Hi, Phil Goss here.
Hi, Phil.
Hi, 18-year survivor, Leiomyosarcoma, with 12 years of no evidence of disease. Came back in 2015. So we're fighting the good fight. I want to make two comments, if I may. As a 30-year attorney, I can tell you that getting the state attorney, the insurance commissioner involved, will get the attention of a medical billing company or any kind of medical provider. Don't underestimate the power of going to the insurance commissioner. And many times you can make a complaint online and they're statutorily required to follow up on each complaint. Now, if you're not to the point yet where you're not hearing what you want to hear, I would suggest at the bottom of a letter, you can always CC the state insurance commissioner. And again, I can promise 30 years of experience has told me that that will have an effect. The second thing to consider is that when you go to a provider, many times they're going to want to know who's financially responsible for the bill. And my advice to you is, even though you feel guilty, my wife or my husband, has cancer and I want to support them, do not voluntarily agree to be financially responsible for the debts of your spouse. I'm only a lawyer in Florida, but I know in Florida, a husband is not responsible for the debts of his wife and vice versa. And I would presume that a majority of the states, if not all, probably follow that same dictum. So there's no reason to be financially responsible, because quite frankly, you're just doing something that you likely do not need to do. No one is going to say, well, unless your wife or unless your husband signs on to be financially responsible, we're not going to give you treatment. That's not going to happen. So keep those things in mind. Don't let them shame you into doing something that you'll regret. You may regret in 5 years, 10 years, whatever, but I'm sure you'll end up regretting it.
That's great advice. Thank you. I didn't know that. I'm thinking in California, I think the husband and wife is responsible, or wife, but I'm going to find that out. That's something new to me. Thank you very much.
You're welcome.
That's great. And so there's another question here from Kathy. Do you get test results before an appointment? I'm a little emotionally thrown when the doctor gives me results in the appointment. So I'm a really old patient. I get my results usually on my chart online before I see the doctor. I actually used to see the doctor right away after a test or after scans, but now I wait a few days. So I don't see the doctor right away because it's usually the radiologist things have gotten way behind. I don't know if it's because of COVID or whatever, but you know, the scans the report isn't available for me right away anymore like it used to be. So I now wait a few days. And you know what? If you're emotionally thrown on your results in an appointment, that's fine. You know, whatever you're feeling at the moment, that's fine. No one says you can't be upset on an appointment. So you get thrown, you leave, but then maybe later at home, when you've had a chance to digest everything, you might have more questions. So I don't know if you can call your doctor, if you do the MyChart thing online, whatever they're doing these days, that you communicate if you need another appointment. So it's okay to be thrown on an appointment. Just, go home and come back and go through it however that is for you. Nothing is set in stone in cancer, you know. I will tell you, I have a lot of people that go over my results now because I have so much disease. I mean, I go through them, my sarcoma doctor goes through them, my surgeon goes through them, and the radiologist. So that's 4 people. I've had 3 mistakes over the years on my scans. In 19 years, I've had 3 mistakes of someone reading something the wrong way. So, I have learned how to read scans as well. I can kind of look at an MRI or kind of look at a CT scan and know what I'm looking at. So, but I have 3 other people looking at it as well. I can't tell you how many years I've had a rib met, like a little tumor on my rib that was missed, or something else here or something else there. So, so now when I go, I always really like triple or quadruple check. So yeah, so however you go through this for you, I mean, I honestly do scream in my car. So whatever works for you, that's what you need to do for you. As long as in the end, you get what you want out of the appointment and your results. Someone else is asking, I have more questions about the emotional part. I'm direct in the office, but I fear being unwelcome when I'm not there. You fear being unwelcome when you're not there and delay contacting. That's really interesting. I definitely have had times in 19 years where I've not called someone when I really should have. I don't know if it's not for the same reason. It's just that, on that particular day, I just don't want to deal with cancer. But I don't think you need to have a fear of being unwelcome. You need to contact someone when you need to contact them because, we need stuff. So I don't know if you want to delve into what that fear is, but you shouldn't feel, when I call my doctors, when I need them, I call them. And I don't worry about what they're going to think. I mean, they're always running away from me. They're always saying I have to go and I have to get to the next appointment. So, and if your doctor says, I had my surgeon once say to me, I have a heavy case. I can't sit here very long today. And I looked at him and I said, that's fine. When can I call you? And he said, call me tomorrow at 2:00 and we'll discuss some more. So that's what I did. So, if your doctor's running out the door and doesn't have time for you, the best question is, when do you have time? Like, can we make a phone date? I don't know if your doctors are doing Telemed right now, but my sarcoma oncologist, not my surgeon, he won't do Telemed. He wants to see people in person. But my sarcoma doctor is on Telemed now. And sees people in person. So I said, what's better for you, Telemed or, come to the office? And he'd much rather do Telemed. So I'm kind of falling in love with Telemed because I don't have to drive 2.5 hours from San Diego to Los Angeles. And I get to talk to him for longer. He seems more relaxed on Telemed. So, I would say don't ever be in fear or feel uncomfortable contacting your doctor or whoever for anything, whether it's the doctor or the assistant, and if you do feel uncomfortable, something that makes people feel comfortable, the person you're calling, is that, a couple of you that know me in person, I am a little sarcastic and I kid around a lot. So I'm from New York and I moved to LA. So I'm just a little bit sarcastic. So I would get on the phone and say, even to the assistant, you must be so sick of hearing from me by now. Or I'm sorry to bug you, but I'm just going to keep doing that. So don't be afraid to lighten up your situation in caring for yourself, because I'm also very cognizant of, you know, I was going to talk about this the other day on the Facebook group, but, you know, I can't imagine being my doctor. I mean, I've had the same doctors for 19 years. A lot of these doctors have been in the sarcoma business for, you know, 30, 20, 30, 40 years. How many people have they seen honestly pass away, be really ill? It's got to be really tough. You know, I try every so often not to just look at it from my point of view, but to look at what they see every day. You know, I am essentially getting old with my doctors. So I have white hair, they have white hair, they have medical issues, you know, so I try and be aware of that when I talk to them as well. And I think I get better. And I also, speaking about doctor's appointments, if I don't get what I want out of a doctor's appointment, especially being in so much palliative care now, I find that the more disease that I have, the harder it is for them to be on an appointment with me and me to be on an appointment with them, because, you know, we've known each other for 19 years. We're all emotionally involved with each other at this point. So I email my doctors a lot. They both like email. So I don't know if your doctors like email. It's like I email my doctors all the time. I was very upset after an appointment once because I had a lot of disease that grew. And I wanted to get my point across about how I felt about further treatment and what I wanted to do and not do. And nobody was really wanting to talk to me about that in person. So I emailed the 3 doctors I see most often. And I think it's the longest email I've ever done. It's probably would be like 1 or somewhere between 1 and 2 pages. And I had to have that talk with myself, so I had it with them. We had the talk. I had the talk with them by email. I told them how I felt about the whole. This was probably when I was at 17 years. I told them how I felt about my entire 17 years, and how I felt about palliative care, and things that I wanted to do with myself in the end, and things that I didn't. And so I emailed them this whole huge thing. And I have to say, after that, my care changed for a really long time. Everybody was very much more communicative and understood where I stood. And it wasn't that I was leaving this earth. Obviously, I wasn't, because that was in, let's say, around 2017, and now it's 2020. But I felt like I had to get that out. And that was the way for me to do that. So whatever is comfortable for you. If you actually like your doctor, but you feel like the communication is not coming, what is your favorite mode of communication? And what do you want to get across to that doctor? I think that's really important as well. And I don't know that, you know, you're ever going to get rid of, you know, those emotions. And maybe you need that second person to come with you and sort of absorb stuff with you. My favorite person that came with me on an appointment was a complete stranger. In the very beginning of my care in 2001, I went to like a wellness community, you know, not sarcoma specific, not cancer specific. And it was when I first got diagnosed, and I wanted company. And I was so emotional that I didn't want the person coming with me to be emotional. And the wellness community had volunteers, like a buddy program. And the woman that came with me, her name was Rachel, and I'll never forget her because I only saw her this one time. She came, and she was a breast cancer survivor, and came with me on my very first doctor's appointment, a complete stranger, and sat with me. And she came with me on my very first chemo appointment as well, and made me laugh hysterically because she wasn't really my friend. She wasn't really emotionally involved with me personally. So she could really be, you know, a fabulous advocate. So my point for you in this, conversation today is that you have a right to feel better in whatever you're going through, whatever that is for you. And that, whatever you're suffering, especially during these crazy times with COVID and being afraid to go to the emergency room, and maybe you're afraid to even go to your medical center, at all, that whatever you are feeling and doing, you have a right to feel, that you shouldn't feel less than. It gives me pleasure to take control. I can't maybe control the growth of my cancer right now, but I can control what I do in certain aspects of my life to get better care for myself and for others. And that has always been a goal. So if you can take some of this emotion that you have and put it in a place where you can still experience it, and yet it helps you, that's a wonderful thing. So a lot of my aggravation, honestly, and misery, and a lot of my joy, and then I change that to joy by helping others and getting something when someone says no. That's like my most favorite thing in life, to get someone something medical when everyone is saying no, and then I get it for them. I think to myself, well, I may have a lot of cancer, but I had a really good day today. Like if I got someone's, I've gotten total bills, $6,000 bills, $10,000 bills. I've gotten bills like this totally forgiven, which is crazy, because I needed to have a good day that day. So this talk, and Sharon says she has a book to recommend to everyone. So my goal for you today is not really, I gave you some, very defined information on what to do to maybe get a better result in your care. But really, in the end, it's about what goes on in your head and what you can do for yourself on this day to give you a better day. So that's how I'm going to end. It's been a little over an hour. If you guys have any more questions, I can answer some questions. Sharon says she has a book to recommend. I don't know where she went. I imagine she's in there.
Can people see that?
Yes.
Anyhow, the book is Fight Your Health Insurer and Win, and it's by Lori Todd.
Oh, wonderful.
Tells you how to write appeal letters and what the steps are to go through this. And it's very practical. So I'll write it in the chat book for you. The chat box for you, okay?
Hi,
Hey.
Amy.
Hey, you have a question?
No, I don't have a question, but I would like to add to the question that Kathy had asked, if we get the test results before an appointment. So I go to Memorial Sloan for the treatment, and they usually don't prefer to share the test results of the scan before the appointment. And I always push them that, hey, I want to see the results before I see the doctor so that I can ask intelligent questions, right? Like, I don't want surprises at the end or during the appointment, right? And it's possible that during the appointment, the doctor might miss out on any points, that we later on see the results. So I always pushes them. I always push them that, I want to see the results 1 or 2 days before the appointment so that, I can go over them and ask the questions to the doctor. And they always yield to it. They don't prefer that, but you have to push them that if you want the results before the appointment, that, hey, I want the results before the appointment so that I can ask the questions to the doctor. So you have to push them sometimes if they don't agree to it.
Exactly. Thank you. Yeah, you have a right to that as well. So if they say, you actually have a right to that information.
And would you know, sorry, it's Heike here. Would you know why they do not want to share that before? Did they give you any reason?
The reason is the emotional end. Like if you've had, if you're reading your results before you see the doctor and all of a sudden you see that your tumor went from 2 millimeters to, 20 millimeters or centimeters, and 2 centimeters, and now it's at 10 centimeters, you're going to have a reaction. So, that's really the reason, is that they don't want you to read all this stuff, not understand it. And then when you do go on the doctor's appointment, you're a total mess.
Okay.
That's the only reason.
Okay.
This is Kathleen. I have a comment and a question. I've had, unfortunately, a couple scan misreads, at major institutions, and I've had to go to patient relations, and I have done that and have really been have hammered them quite, and gotten a call from the head of radiology and just said, this is, how can you say, as seen on previous scans, when you told me on the previous 3 scans there was nothing. And finally went back and forth, and I'm like, I need this amended because if I go to a second opinion or something like that. So I've made the head of radiology at a major institution call me, and it's happened twice. So don't ever be afraid to go to patient relations. And I've gotten really ugly, and a couple of times I've said, I expect a little better out of a top 10 cancer hospital. And I've used those words. And when you say those words, their attitude turns around. It's like, okay, how am I going to help you? How am I going to make this right for you? No, it's not going to change my diagnosis that you should have told me 3 months ago that those tumors were there and you didn't see them. And that I stayed on a chemo I shouldn't have. That part I can't do anything about. However, I'm hoping I'm helping the next person. So that's my comment, is don't be afraid to go to patient relations. And,
exactly. Mistakes happen everywhere, even in the best places.
Right. But you're helping the next person, and you're letting them know you heard. And then the second is, I sometimes pay medical bills in advance on something, and just because it's easier, or they don't take my insurance, but then I can go submit a claim to the insurance company as a out-of-network provider and get paid at, the 60% of the minuscule amount they pay, but they fight and they drag their feet on that. Can you take an insurance company to small claims court in California?
Wow, that's a great question. It would take you forever. I don't think so. First of all, the fact that you pay bills in advance, how incredible. I wouldn't do that.
Well,
I wouldn't.
Yeah.
I wouldn't pay that. I'd wait to get the bill, because once you pay the bill, they're so much harder to negotiate or to change or to fix. So I understand doing that, but if I'd wait till I get the bill, because then you can negotiate it. If that's, once you pay it, it's done. I mean, I don't think it will take you forever to do that. Usually, unless it's a huge bill, probably not. Unless it's a huge bill. If it's like a $500 bill or $1,000 bill, no. But if we're talking $10, $50, $20, $30, $50,000, maybe you'd have to talk to an attorney. But I try not to pay bills until I get them, because then I can analyze them with the insurance company and the financial institution. So not just with cancer, with any kind of medical stuff.
Yeah.
I did it for my daughter the other day. She had to go someplace for an opinion, and I said, what's her bill? And they said, we don't know. And I said, I need a commitment to you. She's, you're not in her network. I need a commitment to know the roundabout bill if you can't figure it out. So they said it's going to be between $500 and $1,500. And I said, because that tells me if we can even come to you or not.
Mm-hmm.
So I try to get pre-pricing on everything, even other than cancer, but I don't pay it till I get the bill, because I want to. And if it doesn't hold true, if they told me between $500 and $1,500, and all of a sudden I get a $20,000 bill or a $10,000 bill, guess what I'm not paying? I'm paying my $1,500 that you told me on the phone, because I have it recorded, I have your name, I have the commitment. So, that might be a better way to do it.
Yeah, sometimes they give discounts if you pay in advance, or if you write a check too. There's a discount versus then they don't have to pay process the credit card fee.
Yeah.
But then I have to turn those bills back over to the insurance company, and they're just dragging their feet, and it's something they should pay. And they just drag their feet. It takes them 3 months to pay it. And then, I know they're going to pay 60% because it was out of network or whatever, but.
Have you done a brick and mortar letter? Like, something crazy I would do in that case is I would see if there's a corporate patient advocate at your medical institution and at the insurance company, because lately every medical institution now has usually, I know they just did one at Cedars and a few other places. They have what's called a corporate patient advocate, where they deal with this stuff.
Mm-hmm.
And
I would look up the CEO. That would be a CEO letter for me to the CEO of the insurance company, and I track it and I mail. I track it and I make sure it's hand delivered to his office. And people will say all the time, "Oh, they're not going to respond to you," but every CEO letter I've ever sent, I've had a response to. I've had somebody call me, and say, we're direct, maybe not the CEO, but I'm directed to call you by the CEO. What can we do? What's going on? So it might behoove you to try a brick and mortar letter to the insurance company.
Okay, yeah, I've tried getting the name of the CEO and they won't give it to me, and I can't find it on the internet.
I can look it up. If you want to PM me the name, you want to PM me your insurance company, it probably would take me 5-10 minutes to find the CEO for you. They're all listed.
Yeah, I thought so. Okay, thank you.
You're welcome. Anybody else?
Hey, Amy, question for you. So as a cancer patient, I sometimes see the integrative doctors, and they always request for the payment in advance, like, $500 consultation fee or $600 consultation fee, and they are out of networks. They don't accept insurance coverage. So what they say is, we'll give you the codes basically that you can give to your insurance companies. So how do we go about that? Because
you might want to call your insurance company in advance,
right.
to see if your codes match their codes, to see if they're the best codes.
Right.
That's really it. I understand if you're going for a second opinion. I've paid that $500. There's not much to get around that, but I do call the insurance company. If a hospital or a doctor is giving me a code, I'll call the insurance company and say, is there a better code for less money?
Okay, got it.
So that's pretty much all you can do on that, because they really want that, it's not a minimal fee.
Right.
But they want that their minimal fee. So I always see, that's where the preventative versus diagnostic or whatever. I always try I call them and I say, is there a better code than this, or is this what I'm stuck with that I have to pay this?
Okay, got it. Okay,
But ask them for that $500 or $600 that they want you to pay. I always ask, is there any financial aid available? Is there any, if I need financial aid, is it available? And some hospitals are for profit. Some hospitals are non-profit, believe it or not. Some hospitals have the non-profit status. So, that's just something to, I would call their financial aid office and fill out all their paperwork.
Sure,
and
see
if you get any help there.
Okay.
If I may make a comment to what Amy said a few minutes ago, there are states that do not allow you to record telephone calls unless both parties are aware that the telephone call is being recorded, and it can be as up to a third-degree misdemeanor in certain states. Florida does not allow that. You can record a call if you tell them, I'm recording this call. Do you agree to that?
I don't record calls personally, but so when I call the hospital in Florida, or I call the insurance company in Florida, the call's not being recorded by the insurance company?
No, they will have to tell you in advance this call is being recorded.
Oh.
For quality assurance, which is BS.
Oh, good. Well, I would ask to have it. I would want the insurance company to record my call. I'm not recording it.
Okay, I'm sorry. I thought you said that you tell them that this call has been recorded.
Oh no, maybe I did, but I want them to record it. I want to make sure they're recording me.
Okay, but they would have to tell you that. I would give you another option. Another option would be that if you called and spoke to someone and they said, well, it's going to be no more than $500 or no more than $1,000 for this consultation, that I would get their email address and I would immediately send them an email saying, per our conversation on this date at this time, you represented to me that this visit would cost no more than X amount of dollars. If I am mistaken, please respond to me immediately. Otherwise, I'm going to take this as being the deal that we've cut or something along those lines. And then you have something in writing, because if you ever go to small claims court, which I don't know a state in the union that does not allow you to sue anybody in small claims court as long as you're within the jurisdictional limits of the amount. You can't sue somebody in small claims for $1 million, but you can sue somebody in small claims up to a certain amount. Then you have something in your hand. And it may not be as good as them emailing you back and saying, yes, I agree to this, but you can say, you didn't disagree, and here I have it in my hand. And that's, you know, that's pretty compelling evidence if you ever have that kind of issue.
Thank you. Exactly.
Wow. I know who we need for our next guest speaker.
I just asked him. I told him maybe he should do a.
Well, I'll be very, you know, willing to help in any way.
I'm just gonna end with this because I have to go feed and walk my dog in the 100-degree heat. But I wanted to tell you I'll end with this story. This is actually a family member that I have that went for something, you know, not cancer related, but went for an opinion on something at a major institution. And I got her $6,000 bill forgiven just because they didn't perform the way they said they were going to. So, I mean, you can try, you know, we had traveled, you know, hundreds of miles to go to this one place to see this one doctor. They billed us. They told us she was covered by insurance. She wasn't. So I basically wrote a letter stating, not only did you say she was covered, but we came to see you for absolutely no reason, and we didn't have to pay the bill. So I want you to think out of the box and just be inventive and take care of yourself. And it's been fun to be here today.